Hello, everyone. Thank you for joining today's presentation from the Health Connector for Business, ConnectWell, the Health Connector for Business Wellness Rebate Program. We have a number of participants who have signed up, but we're going to go ahead and get started on time. I'm Shaitra Sanders from the Massachusetts Health Connector. I will be facilitating and co-presenting today's session. I'm joined by my colleague, Nina Dubison, who will be co-presenting today's information, and we are here to help answer any questions you might have. I would like to take a moment to thank Certified Brokers on the Health Connector for Business for their support in promoting this wellness rebate program. Before we get started, just some information about our presentation format and a few housekeeping rules. Just to let you know, everyone's audio has been muted and video has been disabled. The presentation portion will last approximately anywhere from 15 to 20 minutes, and then we'll have time for a Q&A period at the end. If you would like to ask a question at any time, please use the chat functionality. Our colleague, Ashley Liu, will be monitoring your questions throughout. Please do not disclose any personal information or protected health information about any of your own information when you ask your question. We will not be able to answer those in full detail on the webinar. If you do have a specific personal scenario that you want to discuss with someone, we'll be providing contact information during the presentation that you can utilize to outreach after the webinar. We are recording today's webinar. Following the presentation, you'll receive an email with the presentation PowerPoint attached and a video link to review. So there's no need to take detailed notes. Please feel free to email us any feedback or comments on the presentation if possible, as we appreciate your informative responses on today's session, and your input will help us develop future presentations. So let's go ahead and get started. ConnectWell, the Health Connector for Business Rebate Program. I'm going to provide you with a little bit of an overview of the Wellness Rebate Program. Just to let you know, our ConnectWell program is designed to provide employers who offer health insurance on the Health Connector for Business with the opportunity to earn up to 15% back on the amount that they contribute to their employees' premiums throughout the year. Just to let you know how much that could be, in 2021, employers received an average rebate of about $3,674.79. Now that's an average rebate. Again, that depends on how much of the contribution as an employer you're putting into the employees' premiums, and also how many employees are enrolled. So it could be somewhat lower than that number or much higher. It all depends on how much is being contributed towards your employees' premiums. And just to give you an idea of the timeline of what happens is a employee will participate in one of the wellness activities, and we'll go into that in a little bit more detail as we move along. They'll submit the activity online. The employee will receive a $100 Visa gift card for successfully completing and submitting one of those activities. And then at the end of the business year, the business will receive back a rebate for up to about 15% of what was contributed into the employee's premiums if at least 33% of those employees successfully complete and submit a qualifying activity. And that's money back, not a rebate, not a discount off next year, actual 15% back. What are the benefits of this ConnectWell rebate program? Well, 15% back to you as an employer. You can, like I said before, you can actually receive this rebate back, it's money back, and you can receive it up to 3 plan years. So 3 years you can get this 15% back. The employees are incentivized for participating in a wellness activity, and they can receive a $100 Visa gift card for completing a qualified wellness activity. I just want to let you know that those 3 years do not have to be consecutive. They can, if you don't hit it 1 year, you can try the next year. And the years only count if you actually received the rebate back. Who is eligible to participate in ConnectWell? So just to let you know, eligibility is determined at the beginning of the plan year. So it's what is in place at the beginning of your group's plan year. And that is that the group and the employee must be enrolled in a health plan through the Health Connector for Business. That's an eligibility requirement. And that the group must have anywhere from 1 to 25 full-time employees enrolled at initial enrollment. So this is based on initial enrollment. So if you start off with 25 employees and then you gain more during the year, the 25 at the beginning of the year makes you eligible for that benefit year. And just to give you an idea, what are we talking about? Benefit years. Just keep in mind that every time you enroll, there is a enrollment timeline. This is just a reminder that, when you're offering health insurance, if you're in the process of offering health insurance right now, you want to come to our website. You want to offer your employees the health insurance by the 10th of the month prior to the month you want it to start. You want your employees to enroll or waive with a valid waiver by the 20th of that prior month. Make your first payment online by the 23rd, and then your coverage, your plan year starts on the 1st of that month that you wanted the effective date. So we're talking for ConnectWell, the 1st of that month where the coverage begins. So I mentioned that employees receive a $100 Visa gift card for completing one of the 30 pre-approved qualifying activities. All the activities can be found on our website, and that hyperlink that says website will be available in the PowerPoint that we send you later. But just to give you an idea of what those activities are that the employee has to successfully complete at least one during the group's plan year, they focus on mind, body, and money. So mental, physical, and financial health. And they can range anywhere from opportunities like volunteering, taking a physical fitness class, going for your wellness visit, taking a financial literacy class or any kind of program that promotes savings, paying for college. These are just a sampling. Again, there's 30 pre-approved wellness activities that are on our site, and employees can pick from any of them and just successfully complete and submit one of them during the plan year. So when you're thinking, how do I get 15% back? How is that calculated? When you're thinking of this, and we do all the calculations for you, so don't worry, but when you're thinking about it and thinking how much will you get back, just remember that as an employer, you'll receive a check equivalent to 15% of the total premium contribution. So what the business put towards all your employees' premiums. And if those employees receive gift cards, those gift cards are subtracted from the rebate total. So for instance, here's a really quick sample of what could be your rebate. Imagine you're a coffee shop and say you have 5 employees enrolled on the Health Connector for Business. 3 of them successfully complete an activity and receive a wellness gift card. Now, if the business was contributing, if the business's premiums added up to $2,500, full amount, and then the employer is contributing about 60% of that $2,500, that would mean the employer is contributing about $1,500 a month. And that is where the 15% comes from. So that would be $225 that the employer is contributing a month times 12 months, and that would equal out to $2,700. So that's 15% of the employer contribution. But then remember, 3 employees got the gift card, so we have to deduct those $300 gift cards. So there's the $300. And then the final rebate that you'll receive back as money back will be $2,400. So that's just a really quick overview of how the rebate's calculated. And at the end of the year, what you'll receive back from my colleague Nina is something that looks like this. And it's a breakdown of the rebates. It's a breakdown of who the employee is, how much you contributed towards their premium, how much you're going to get back, how much gift cards were deducted, and then the final rebate due. Now, I just want to remind you again, eligibility is determined at the beginning of the plan year. So if the plan year started, for this instance, as you can see, with 3 employees, we need for 1/3 of those employees, 33%, to participate in a wellness activities, because it's based on those 3 employees. But somewhere during the middle of the year, a 4th employee enrolled, that fourth employee can go towards the 1/3 in this case. So even though they weren't part of the beginning one, they can still participate in a wellness activity, and they can still be the 33% towards the reaching the rebate eligibility criteria. Just to let you know, we help you. So we provide informational material as a business. There is this flyer, which of course we will pass along with the PowerPoint. This just gives you an overview of ConnectWell, how it works, and where you can call to ask any questions or any inquiries that you have on your ConnectWell rebate eligibility. And then there's also information material for you to pass along to your employees to get them excited about participating in the wellness activity. They're going to earn a $100 reward gift card. It's right on there. So they're going to want to take part in one of these items. I'm going to turn this over now to my colleague, Nina, who's going to go a little bit more into detail on how the rebate works and what is needed to get this rebate. Nina?
Thank you, Chaitra. So we're going to go over the timeline and communications for employers and employees. So at the start of the plan year, groups will receive a welcome email. The employer and the employee will receive a welcome email on the 10th of the month. And in that email, it will introduce the program, explain the incentive, and how employees can participate. Throughout the plan year, employees and employers will receive a progress reminder that's sent every other month. And for employers, they'll receive the current group participation rate. And then for employees, if they haven't submitted a wellness activity, it'll just give them a friendly reminder letting them know that they can receive this incentive and how they can submit their documentation if they've completed a wellness activity. Throughout the plan year, if a group meets the participation requirement, the rebate requirement, they will receive a congratulations email. That email will explain to the employer that they've met the requirement and that they should be receiving a follow-up email at the end of the plan year with documents that they have to fill out for us to process the rebate. And for rebate submission, again, we will send employers documentation for them to complete, to send back to us so we can process their rebate. And then employees will also receive their $100 gift card through email. When a group renews, they will receive a renewal approval or denial. So if the group has not received 3 rebates, they will continue to be able to participate in the program and explain to them that they can send out information to the employees to participate for the following plan year. If a group is no longer eligible, that email will explain to them that they're no longer eligible because either they have received 3 rebates or they're over the 25 employees limit for participation. So here's an example of the rebate disbursement email that we send out to groups that are eligible for the rebate. So the email will congratulate the employer, letting them know that they're eligible for the rebate for their previous plan year. And in that email, it will include all the forms that the employer must complete. So it will include the rebate disbursement form, the W-9 tax form that we must receive from the employer. Also, we require a proof of employer contribution. So we ask for at least 1 month of payroll so we can sufficiently verify the employer contribution amount for each employee. And then we will also, due to COVID, we are working remotely, so we're no longer issuing paper checks. So we will also ask employers to complete an electronic payment authorization form so we can issue the rebate electronically, electronic deposit. Here's just the overview of the rebate process. So for example, a group renews July 1st. We give employees an extra calendar month to submit their wellness activity. So in the month of July, employees can submit any activity that they completed in the previous plan year, and they'll have until the end of July to submit that documentation. The following month is when we will process the rebate disbursement form and send out those forms to employers. And again, in the previous slide, I showed you what that email will look like. And then when employers send back all the documents that we are requesting, it takes about 30 business days for us to process and deposit the rebate to the employer. Reasons why the schedule could be delayed is if the employer is slow to respond to step 3, insufficient documentation or insufficient proof for the employer contribution amount, or just failure to submit one or all documents for us to process the rebate. This is the employee user timeline communication. And again, at the start of the plan year, employees will receive a welcome email. I'll explain the program, the incentive, and how they can participate. They'll get participation reminders. Again, this is sent every other month until employees approved for their gift card. And then also when the employee completes their activity, they'll submit their proof through an online submission page. And then if they're approved, they'll get an approval email. And if they're denied, they'll receive a denial email. And the denial email will give a general explanation of please double check, your documents, make sure it has all the information that we're asking for. But they can always resubmit their documents or resubmit for another activity. When they're approved for their wellness activity, again, they'll receive a reward link. That reward link is sent from our gift card vendor, Tango. In that link, it will take them to the $100 reward page so they can activate their gift card. And so how does the verification process goes for employees? Employees will submit different verification documentation depending on what type of activity. We have a full list of qualifying activities, so employees can determine what documentations they need to submit. Documents they can submit for the activity could be proof of registration with their receipts, invoice that shows their payments for the activity, proof of completion, such as certificates. There's also a wellness activity form, a paper form that they complete. And that's usually for primary care visits, like their doctor visits, volunteer activities, or trainings that they attend with like their nutritionists. And that link will be on our website as well, so employees can download that actual form. And again, employees must submit their documentation through our online web form on our website. And so due to COVID, I know we're all coming back into the office, we're all leaving our homes, but you can also complete an activity at home. So if employees work from home, they can complete their activity such as, and I believe that in the next slide, we'll have a list of that, but many of our qualifying activities can be done at home, meaning they can still participate in the program, but then still practice safe social distancing. And then again, as a reminder, employees receive a $100 prepaid Visa gift card by email after they've been approved for the activity. And employees must complete these activities within their current plan year. So here just an example of activities employees can complete at home and online. For example, online financial education courses, online courses for healthy eating, weight loss programs. They can do their online workout subscriptions from home. And they can also do online stress management, meditation, and mindful courses from their home as well. And we have a full list of those activities. Here's an example of the activities that we have listed online. So this one is volunteer. We have the minimum requirement, which is 2 events. Then we do have a detailed requirement, so it has to be nonprofit or faith-based organizations. And then we have a list of resources for employees to check out if they want to do this activity. And then on the right side, we have a list of the documents that we require for employees to submit for each activity. Here's just a screenshot of the online web form. The web form is pretty straightforward. Employees who are eligible to participate in wellness, what they'll do is just go on, put their most basic information, which is their name, their date of birth, and the last 4 digits of their SSN. And then what they'll do is select the activity that they've completed. So they'll just click whichever it is, mind, body, or money. If they need a full list of the activities, they can just go back to the website and pull up that information. And then in the next screen, it's more detailed. They'll have to indicate the category within the 3 activities that they participated in, the name of the program or facility, the dates they've completed the activity, they started or completed the activity. And then I believe on the next screen, they'll have to upload the document. So you can upload any type of file. And once they've uploaded the document, they'll submit it. And once the document is submitted, they'll receive a notification saying that, thank you for submitting your documentation. You should be hearing back from us once the activity has been reviewed. So the employee submission page serves several purposes. It allows employees to submit their wellness activity, but it also notifies its employees who are ineligible to participate. And one of the few reasons why an employee would be ineligible to participate in wellness is if the group has more than 25 employees enrolled, the employee is not enrolled in a health plan through the Health Connector, or the group has received 3 rebates in the previous years. And it also will notify employees who've already received a gift card for that current plan year. So once an employee has submitted their activity and they've been approved and received their gift card, they cannot submit for that plan year. They'll have to wait until they renew to participate again and get a gift card. So here's just an example of what it would look like if an employee is not eligible to participate. So I'll explain to them that they're not eligible to participate in ConnectWell. And if an employee ever receives this and they have more questions, they can always call customer service to get more information. And again, 1 gift card per plan year. So if an employee has already successfully completed an activity, they will get this notification letting them know that you've already received your gift card. You'll have to wait until next year to participate. So again, employees have until the last of the month after they've renewed to submit for their previous plan year. They can be approved for that previous plan year, but if an activity is denied, there are 2 types of denial. So there's a soft denial. The activity is acceptable, but the documentation is missing certain information. So they'll have to just resubmit additional documentation, or the document must have like their name, the name of the provider or facility, and the dates. And if an activity is hard denied, that means the activity is not acceptable. So they'll have to come back and resubmit for a different activity that is an acceptable activity. We also send communications to your broker. So if you have a broker, your brokers will receive a quarterly email regarding their group's participation percentage. In that email, it'll have all their groups, the participation percentage as of date, and then the group's plan year and when they're renewing. There's also resources in that email that brokers will share with you that you can share with your employees so you can reach the minimum participation requirement. And so we're just going to open up for any questions.
So we have a few questions that were already sent in, but if anyone else has any questions while we're going through the ones that we already have, please feel free to put them in the chat or in the Q&A, and we'll definitely get to them before we sign off. So the first question that we have is, could you clarify if the group has 45 employees but only 20 are enrolled, would they be able to participate in the ConnectWell program?
I'll take that one.
Do you want to take that one? Yeah, go ahead.
I think it was in my first part, so I'll take that one. Yep, so it's only based on who is enrolled at initial enrollment. So at initial enrollment, if 20 employees are enrolled, then yes, as long as you haven't hit the 3 years, your group would be able to participate in the ConnectWell, as well as if during the year, the other rest of the employees enroll, it would still be based on your first initial enrollment of the 20 employees.
Perfect. The next question is, if an employee's activity submission is denied, can they submit another activity? Is there a limit to the number of times that the employee can submit activities until they get approved?
No, so there is no limit. So they can come back, if they receive a denial, they can come back and submit for the same activity. It just depends on the denial. So if it's a soft denial, they just need to resubmit additional documentation. If it's a hard denial, yes, they have to submit for a different activity.
Okay. And kind of a related question is, will the email with the denial say the reason for the denial?
For hard denials, yes, it will explain the reason. For soft denials, it's more general. So it will tell the employee to just double check their documents to ensure that it has their name, the facility, or the organization, and then dates. So we have to see the exact dates of when they've completed the activity to ensure that the activity was completed within their plan year.
Awesome. Okay, we just have one more question. So if anyone else has any questions they'd like to ask, now would be the time to put them either in the chat or the Q&A box. But the last question that we have for now is, will the rebate form be emailed to me as the employer when my group meets the requirements, or will it be emailed at the end of the plan year?
So it will be emailed at the end of the plan year, and it will be emailed to the person who's listed as the main point of contact in the account. So if you're listed as the main point of contact, you will receive that email from us.
And Nina, just to extend on that, I believe you did mention that the employees have the extra month to submit. So it would actually be a month after the plan year ends. Am I correct?
Yep, a month after the plan year has ended, they will receive documents from us.
Awesome.
Any other questions, Ashley?
I think that's all we have.
All right. Well, again, I want to thank everyone for joining us today on this webinar. I want to thank Nina and Ashley for supporting this, and all of the brokers who supported promoting this to their clients. And from everyone here at the Health Connector, be safe and well. Thank you.